to Navigating Ethical Waters, a comprehensive approach to nursing ethics, where we dive deep into the real-world application of the 2025 Nursing Code of Ethics. I'm Jodi O'Malley, whistleblower and founder of Righteous RN. In this course, we'll explore what it truly means to practice with courage, integrity, and moral clarity in today's healthcare landscape. Let's get started.
Welcome to Module 10. This one is raw and real. Today we're addressing one of the most painful but necessary topics in ethical nursing: division within the profession. Let's be honest, COVID policy turned nurses against each other. The pandemic didn't just create a public health crisis. It exposed deep cracks in our profession. Nurses were pitted against each other. Vaccinated versus unvaccinated, rule followers versus questioners. Instead of protecting each other, many silenced and shamed one another. But our code calls us to something higher. And that is what this module is really about: division. Not political division, not left versus right, but ethical division. What happened during COVID was that some nurses asked questions. Some did research, some spoke up, and others didn't, or refused to listen. That silence, that dismissal, that refusal to engage in conversation is what divided us. I want to bring up another major moment that shifted the trust of many nurses and healthcare professionals. Pfizer asked the courts for 75 years before releasing their COVID-19 trial data. Let that sink in. The FDA approved a product under Emergency Use Authorization, EUA, that the manufacturer didn't want the public to see the safety data for until the year. Let's look at a case that shows what happens when one nurse stands up and everyone else steps back. Jennifer Bridges was a respected RN at Houston Methodist. When the hospital announced its vaccine mandate, she took a stand. She created a petition and gathered over 200 signatures, but most nurses signed it in secret. Leadership threatened her, and co-workers criticized or abandoned her. Only a small handful of fellow plaintiffs helped her raise funds, organize, or speak out. Jennifer carried the burden of advocacy, media appearances, events, and lawsuits, while others benefited quietly. This is what division looks like. Not just disagreement, but silence. ANA, AACN, and NCSBN all played a role in justifying mandates. They framed compliance as ethics and dissent as misinformation. But truth didn't change. We just weren't allowed to speak it. Their silence cost lives, jobs, and trust. This wasn't just social pressure. It was institutional. In December 2021, the National Council of the State Boards of Nursing, the NCSBN, released a policy brief that changed everything for nurses who were speaking out. It warned that any nurse who disseminates misinformation, without ever clearly defining what that meant, could face discipline. What's important to know is that this policy was released the very same month I was scheduled for my Arizona board hearing after I exposed serious ethical violations at my hospital. Now, after a year working the bedside, they told us, take this shot or lose your job. This isn't informed consent. This is coercion.
Institutions are trying to set up mechanisms for reviewing applications for religious exemptions and et cetera. I think there probably is a reason to allow religious exemptions in this case, in the case of vaccine mandates for COVID. But I do think that, for example, in the healthcare scenario, if somebody is not vaccinated and gets a religious exemption from vaccination, then their responsibilities, their patient-facing responsibilities should be limited, and because it's dangerous.
In 2021, the dominant mindset was clear. Public health was placed above individual autonomy. Nurses were expected to comply without question, even if it violated their consciousness, their religious beliefs, or their professional judgment. But the 2025 Code of Ethics recenters what should have never been lost: the right to moral objection. It reinforces that nurses have the right and the responsibility to protect patients' rights and their own integrity, even when facing institutional nurses as facilitators. We translate evidence, check understanding, the teach-back method, and keep the patient's goals primary. 5.3 backs integrity in practice. 6.2 calls for an environment that enables ethical dialogue. Protection against coercion and retaliation. Coercion, fear, incentives, or omissions erodes consent. 3.3 culture of safety and 6.2 ethical climate require us to intervene. 5.2 anchors the courage to do so. Full disclosure. Patients must hear all reasonable options, even those not offered at the facility. In your own words, what are your choices? If something is missing, I name it and document that I disclosed it. Consent without pressure. If I sense fear, incentives, or time pressure, I pause the process. Let's take a moment. No decision yet. I document the concern and who I notified. Act on safety signals. Adverse events and near misses get reported. Internal safety reports or VAERS as applicable. If a protocol seems harmful, I stop the line, escalate to charge or ethics, and chart the rationale. Moral courage is protected. If a nurse raises a conscientious concern, we route to ethics consult and protect from retaliation. Integrity isn't its subordination. System level advocacy. We surface patterns, data, cases, bring them to leadership, and collaborate across services to fix policy, not just work around it. These weren't just hurt feelings. They were ethical shortfalls. Provision 1, dignity. Respect and compassion apply to everyone, patients and peers. Ostracizing or shaming violates dignity. Provision 4, integrity and accountability. Our responsibility is to act with integrity, even when policy says, don't question it. Provision 5, support. We have a duty to support our colleagues, create psychological safety, and stand with those who raise concerns. Provision 8, collaboration, equity. Ethical care means partnering with patients and communities, honoring culture, and ensuring fair access. Silencing voices undermines equity. Provision 9, moral culture. We protect the profession's integrity by speaking up, resisting retaliation, and reinforcing ethical norms. Even if we disagree on methods, we must align on 1.4 and 2.1, full disclosure and honoring patient choice. 5.2, moral courage to pause when consent is pressured. 6.2, an ethical environment that prevents coercion. 7.2, when care overlaps with research, protections must be. Will you stand for truth? Will you protect your peers? Will you rebuild this profession with moral courage? To receive CEU credit, please complete the post-session reflection. How did this apply to your practice? What new insights did you gain? What will you take forward into your daily work? Thank you for being part of this discussion. Your feedback will help refine this module.
For this module of Navigating Ethical Waters, I hope it challenged and inspired you to lead with boldness and ethical conviction. If you're ready to walk this road with other nurses committed to truth and integrity, visit righteousrn.com. And remember, standing for what's right isn't easy, but it's always worth it. See you in the next module.